The Delta variant of SARS-CoV-2 is reportedly more infectious in children than adults. Let's discuss this further with Dr. Eva Cutiongco-Dela Paz, Health Program Director of the PGC or Philippine Genome Center. Good afternoon, Dr. Dela Paz. Are there really studies supporting this claim that the Delta variant that was, of course, found in India first is actually more infectious among children?
Well, right now, I don't think there's enough data to show that. In countries where it has become more common than others, maybe this is their opportunity to look into that.
All right. And do you think if they do discover that it is more impactful on children, or at least it spreads faster through children or the youth, that we should reconsider these relaxed protocols for the younger population?
If you're talking about the Philippines, I think we're not yet relaxing in terms of the president declaring that, the mandatory wearing a face mask, both indoors and outdoors, it's back, right? So which means this is probably not the time yet to relax. But the government has been doing a lot of efforts to to prevent the Delta variant from coming into the country by doing border restrictions, and then also making sure that the 10-day facility quarantine plus 4-day home isolation managed by the LGU will be strictly reinforced.
All right. I think they have loosened restrictions, not by much, but they have allowed point-to-point travel for children. Having said that, Dr. Dela Paz, would you recommend to bump up children or the youth in our vaccine priority list, of course, in the light of these new COVID variants, or should we just stick to our guns?
Well, right now there's a lot of factors to consider, and I think we do have the National Immunization Technical Advisory Group to make decisions on that, and I think the decisions have to be based on evidence, and they will have to do all the background work to make sure that the changes in the recommendations for vaccination will be backed up by science.
All right, and of course, we have heard about the new Delta variant, the Delta Plus variant. What do we know so far, Dr. Dela Paz, about this variant, and what precautions or extra precautions should we take to help stem the spread of that here in the Philippines?
Well, the news about the Delta variant Plus just came probably in the last 24 to 48 hours, and the reason they call it the Delta variant Plus is because there is it has another mutation that was not in the original Delta variant, and that is the K417N mutation, again in the spike protein. So far, even if you look at the news coming from India, they're saying that they don't know enough yet about the Delta variant Plus. And having said that, I think we should still be able to follow what we have been doing, and that is containing its possible spread by doing the minimum public health standards, the BDITR strategies, plus, of course, the vaccination. But in the country, out of the 17 that we have detected so far at the Philippine Genome Center through our genomic surveillance, we have not we do not have any local case yet. All are from returning overseas Filipinos.
All right, thank you so much for your time, Dr. Eva Cutiongco-Dela Paz, Health Program Director of the Philippine Genome Center. We appreciate you joining us this afternoon.